So now we're on to Jessie Fracassi, who will present on health data stewardship, a framework to transform health data management and drive change. Now, Jessie leads the data stewardship team within CIHI. With over 12 years of experience in health data management, Jessie has become a leader in the field of data stewardship and governance, with vast experience in developing and implementing various stewardship-related frameworks, tools, and policies. She has a strong passion for her work, actively promoting and raising awareness for the importance of strong data stewardship programs. So thank you very much, Jessie. I will pass the floor to you.
Super, thank you. I will just work on sharing my screen. So I think you can see my screen, correct?
We can.
Super.
We can see the slides at the moment.
Perfect. Great. So
Perfect.
Thank you very much. All good?
All good. Thank you.
Okay, perfect. Thank you. Okay, so thank you very much for that introduction and for inviting me to speak today. I'm very excited to be here to talk to you all about data stewardship. And I'm going to be talking about the development of a framework that's going to help transform health data management and ultimately drive change in our health system. So before I really begin, I was hoping to get a sense from all of you about your knowledge of data stewardship. So I'm going to ask you all to please raise your Zoom hand using that little reaction hand button, hand raise button at the bottom of the screen, if you feel like you understand what data stewardship is. So if you feel like you could sort of confidently explain it to someone else, I'm going to ask you, if you don't mind, to please quickly raise your hand. I'm having a hard time seeing the screen here. Let's see. Great. All right, thank you, everybody. So next, that's back here. Let's see. So before I jump into the content, I wanted to go over a few key takeaways that I hope you'll get out of this presentation. So first, I was hoping to get that you could all have an understanding of the current landscape of health data sharing in Canada. Second, to get a stronger understanding of what health data stewardship actually is. And lastly, to get an understanding of the project's deliverables and how they will ultimately contribute to the transformation of the management and decision-making related to access, use, and sharing data. So all people living in Canada should be able to safely and securely access their own health information and benefit from it being shared between healthcare providers and across healthcare settings. Unfortunately, this is not our current reality. So there are many factors that are limiting our data from being able to be shared seamlessly with trusted partners and really used responsibly for public benefit. So for example, health data is fragmented, with patients and healthcare providers and health systems being challenged with inefficient paths to obtain the data that they need, where and when they need it. Our current data flows are not modernized and they don't enable trusted data sharing. So this lack of interoperability is not just a technical concern, but it's also highly impacted by the human and organizational factors of interoperability as well. We also know that the sheer volume and complexity of the health data is really growing, and effective data stewardship is going to be required in order to ensure that there is quality, security, and ethical use of data. With the expansion of health data, there are many more potential users and uses for the data, and not all of this is necessarily accounted for in the current legislation, policies, or in the practices. So it's now more than ever that we really need health data from across the country that is trusted and connected, that's accessible and timely, contextualized and comprehensive. It really needs to be relevant for all the people who rely on it, from patients and their families, for our policymakers and healthcare providers. And that's where this initiative comes in. So in order to have that world-class health system, we require a strong foundation, a foundation that really enables data to be used for the benefit of all, for better healthcare and patient outcomes, research, innovation, and economic growth. To help make this foundation a reality, CIHI is advancing health data stewardship to address the systematic limitations in our ability to effectively share and use data. So what exactly is data stewardship? At its core, data stewardship is the responsibility to take care of data for public and individual benefit, both now and for the future. It's really a holistic approach that involves managing and protecting data responsibly and equitably, ensuring its accuracy, privacy, and security throughout its life cycle. It means being transparent about how data is used and shared, maintaining its quality, and adhering to the relevant laws, policies, and ethical standards. It includes making data accessible and usable for all those who need it while safeguarding it against misuse. So in order to contribute to health equity and to really help drive those necessary changes in policy, practice, legislation, and culture, the adoption of stewardship must take into account both strategic and operational aspects. So the strategic aspects of data stewardship really focus on fostering a culture of safe and responsible data use, consistent interpretation of and compliance with laws and policies, and championing effective and compatible governance structures and standards that can evolve. It takes a principles-based approach and considers defined and shared accountabilities and collective decision-making. The operational aspects of data stewardship align and evolve with the strategic aspects. They tend to be the more familiar aspects of stewardship. And they focus on the responsible data management throughout the data lifecycle, from creation through to access, use to storage and destruction, really ensuring that data is of high quality, properly handled, maintained, protected, and used in compliance with ethical, legal, and organizational standards. So now that you have a bit of a better idea of what data stewardship is, how does that play into data custodianship? What's the relationship between stewardship and custodianship? I like to describe the relationship as sort of a counterbalancing force. So custodians have the force to protect the data, and stewards have the counterbalancing force to provide access to that data. While both data custodians and data stewards are critical in data management, each focus on handling specific aspects of the data across their life cycle. So the focus of data stewardship is on that strategic governance and ethical aspects of data management. So more along the policies, the quality, the compliance. In contrast, data custodianship focuses on more of the technical and operational aspects of data management, on ensuring that data are securely stored, accessible, protected. Data custodians sort of house and protect the data on behalf of their organization and are tasked with ensuring that the data is securely managed and maintained. So they don't make decisions on who can access the data or how it's used. Rather, they work in partnership with the data steward who provides clear delegation and instructions on how to access, on how access and security privileges are maintained and monitored. Another key difference here is around the expertise. Typically, stewards are those with a specific subject matter expertise and a thorough understanding of the data and the related policies, processes, procedures, legislation. Whereas the expertise for a custodian tends to be more on that technical side, on that data management, software systems, analytical methods, and tools. So I think that summarizes the current health landscape and provides a little bit more information on the concept of data stewardship. So next up, I want to talk a little bit more specifically about the Data Stewardship Initiative, and I'm going to start with our journey and sort of how we got here. So recognizing the critical importance of timely access to health data, which was highlighted very much so during the pandemic, the federal, provincial, and territorial governments, the FBT governments, and experts across the country collaborated to create a pan-Canadian health data strategy. So this strategy that Christine touched on during her talk as well really outlined a plan to better prepare us for public health disasters, to help clinicians deliver best care possible, to advance research and innovation, and really to empower everyone in Canada to achieve better health. But in 2022, the experts who were advising on how to implement that plan pointed out kind of a huge roadblock. They said what many of us already knew, and that is that our current policies have leaned so far towards protecting the data that we're discouraging one another from actually sharing it. So the provinces and territories agreed that we need to do things differently to move away from that custodian approach towards data sharing and move more towards the stewardship model. So they asked for policies and practices to really help share data while also protecting privacy. And that's what led to an FBT joint action plan. And in that action plan, data stewardship was one of the key focuses. Then in 2023, in August, an FBT Health Data Stewardship Working Group was established to begin the development of a pan-Canadian approach to health data stewardship. So this working group produced 3 reports that were used as sort of that starting point for CIHI to lead further development, revision, and evolution of this work. So that brings us over to 2024, when CIHI officially launched the Pan-Canadian Health Data Stewardship Initiative. So CIHI had gained funding and a mandate from Health Canada to really spearhead the implementation of a data stewardship strategy for Canada's health data. As a neutral third party with strong established relationships with key players across Canada's health system and a strong understanding of data and stewardship principles, CIHI was well positioned to take on this role. So what exactly is the Data Stewardship Initiative? I think this slide kind of captures it all pretty much in a nutshell. It involves CIHI working with stakeholders across the health systems to really drive changes in policy, practice, legislation, and culture to adopt a stewardship approach to data across the country. So in order to set a strong foundation for this work, CIHI is establishing a governance structure, which will include establishing a strong secretariat function to really oversee the implementation of a collective approach to managing and making decisions about data. The aim here is really to address the current fragmentation and the complexities that exist in our health systems that limit the access, sharing, and use of data. So a key objective of the governance model is really to advance that consistency in the data stewardship approaches being taken across the country and to remove barriers for data access, sharing, and use. To effect this change through governance, CIHI is also collaborating with partners in order to develop a pan-Canadian health data stewardship framework, which really calls out that essential aspects of stewardship and how we can take that stewardship approach to data. We've also defined a set of data stewardship principles that will help people working with the data put the framework into practice. And to help move this work forward and really support the adoption of stewardship approaches across the country, we're focusing in on some enabling tools. So some examples of this include use cases, specifically looking at the implementation of patient summary data as a concrete tool that brings the concept of stewardship to life across the health data ecosystem. We're also developing a toolkit to support implementation of the data stewardship framework. And this toolkit will include various aspects or components, such as maturity models to be able to really assess the maturity of the different jurisdictions, sort of where they're at in their stewardship journey, and a glossary of terms or a lexicon to really make sure that everyone is speaking that same language. We're also going to be working with our jurisdictional partners at all levels to highlight sort of promising practices and to support knowledge transition and capacity building within the health systems. Where applicable, CIHI is also going to be contributing to projects to advance consistency and compatibility and to remove barriers. And through the governance structure, CIHI will be monitoring and really helping drive progress on the stewardship initiatives and to identify key sort of issues or challenges that still need to be solved. So in order to do all of this work, CIHI is actively engaging and collaborating with stakeholders and experts, including patients, clinicians, researchers, First Nations, Inuit and Métis leaders, federal, provincial, and territorial decision makers, health data organizations as well. And this engagement and collaboration is really to share information, raise awareness, identify areas of focus that the governance model should aim to address, and support refinements to the data stewardship framework and its implementation. So we're anticipating and really looking forward to building new relationships and partnerships, as well as sort of leveraging the existing relationships between various stakeholder groups as this work progresses. So in the next few slides, I'm going to be focusing a bit more on providing more information on some of these aspects. So specifically the governance model, the framework, the principles, the use case, and some of our engagement efforts. So for the governance model, so we're still working through the details of what a pan-Canadian governance model should look like, but we know its primary goal is really to monitor and drive change on key data priorities. It needs to identify issues or challenges that need to be solved and ultimately support solutioning. So CIHI will not be doing this alone. We'll be working really closely with governments and other stakeholders to set those priorities and support efforts towards that consistent health data stewardship. And as I mentioned earlier, CIHI will have a secretariat role in this new governance structure. And that means we will be providing strategic direction, oversight, escalation, decision-making to really ensure that there's alignment with the principles and any forthcoming roadmaps. We'll be setting an agreed upon a pan-Canadian agenda for improving health data sharing and use. And we're going to be providing support in conducting and contributing to projects to really advance compatibility and remove barriers. Ultimately, the end goal of this work is to update or full-on change legislation and policies, and to fully embed stewardship practices and culture within that health system. So in order to actually embed these stewardship practices, it's important to know what we are embedding. So here we have kind of outlined the key components of data stewardship. So this was developed based on that a previous draft of that FBT stewardship working group that I mentioned earlier. It was updated based on input from our external advisory groups and based off of environmental scanning of best practices. So before I go into the details of each of these components, I wanted to highlight a couple of more general things. So first, notice that in this image, it's a nestled image. So each component fits kind of within the previous one. We also have both the Indigenous data sovereignty and public trust and engagement components that really span across all the other components. And another thing just to quickly point out is the fact that the strategic and operational aspects are clearly distinguished here. Remember earlier when I was saying how important it is to take that holistic view to stewardship to account for both the strategic and operational aspects. Well, here we kind of have this clearly laid out so that it's not just the operational aspects that are the focus, but it's that strategic components of stewardship that come through as well. So in terms of the components themselves, I'll kind of just go in order. So the guiding principles and culture, this is really about those guiding rules that provide a strong foundation to help inform decisions and steer actions in this sort of rapidly evolving health data landscape. It promotes a cultural shift towards data being shared more securely and appropriately for individual and public benefits. So some examples of guiding principles include the Pan-Canadian Health Data Charter, our stewardship principles, the ethical principles, AI for health principles as well. In terms of the legislation, regulations, and agreements, this is really about evolving relevant legislation, regulations, and agreements to advance consistency in approaches and understanding. It really supports that clear, consistent, and relevant legislation that works to reduce barriers associated with data sharing. Next up, we have data strategy, and this is about really identifying those shared data requirements for health system priorities through a comprehensive plan that really outlines how health data will be collected, shared, and used in order to achieve that common vision, shared objectives, and shared goals. So it ensures that there's a common vision that's shared sort of between jurisdictional partners. For the data governance, this is around formalization and enforcement of a set of structures, processes, and rules that guide decisions about data. And it really aims to establish that consistency in data-related activities. The stewardship skills and literacy, this is around providing supports and resources required to help the decision makers, stewards, and really all those who are using data to really understand the policies, the standards, the processes, and the tools, and to ensure that they are fully equipped to perform their roles. Data management, this is probably one of the ones that you might be more familiar with. It's around sort of collecting, storing, and sharing data in that fair, safe, and efficient way through several sub-disciplines such as data standards, data quality, interoperability, data protection. There's a bunch of other ones too. I won't list them all. Data use is around ensuring the data is sort of fit for purpose for all approved uses, including a primary and secondary use. And it really promotes that concept of collect once, process once, but use many times. Next up is the Indigenous data sovereignty piece. And this really helps ground the work in that cultural safety and humility, and really supports building respectful, meaningful relationships. It also ensures that First Nations, Inuit, and Métis people are engaged through their own representative institutions and are able to determine their needs and preferences and how their respective data will be governed. And lastly, we have public trust and engagement, and this is around ensuring that the rules, policies, and procedures are in tune with the needs of the public in order to provide public benefit. So next I'll switch gears a bit to talk about our data stewardship principles. So as you know, principles generally are rules or ideas that guide you. They sort of serve as that foundation to help steer your decisions and actions. These specific principles have been defined as part of the forthcoming stewardship framework as a way to really help build consensus around safe and ethical practices for health data sharing, access, and use, and to help drive those necessary changes in adopting that data stewardship approach. So they were developed based off of, or as a starting point, we used the UK's Caldecott principles as a guide, and then we leveraged things like the Pan-Canadian Health Data Charter, and we also utilized the results of extensive environmental scans. These principles were also underwent several rounds of iterations with our external advisory groups as well. I think for the interest in time, I won't kind of read through all of these, but I do encourage you all to read through them. There's actually some more details for each principle found in the appendix, which I believe if you don't already have access to, you will have access to at some point. So I highly encourage you to have a look at these principles. So moving on to the patient summary. I had mentioned earlier that we'll be sort of assessing a use case on patient summary data. Before I go any further on this, I thought it would be helpful to really provide a bit of context of what is actually in a patient summary or what a patient summary is. So it is a minimal and non-exhaustive set of basic clinical data for a patient. It's specialty agnostic, condition independent, but readily usable by all clinicians for unscheduled or cross-border patient care. Essentially, it's a standardized set of basic clinical data that includes the most important health and care-related facts that are required to ensure that safe and secure healthcare. It gives health professionals that sort of essential information they need to provide care in case of an unexpected or unscheduled medical situation, such as an emergency or an accident. But it can also be used to really support planned medical care. So for example, if the patient's movement or there's cross-organizational care paths. So now that you know a little bit more about patient summaries, you can start to understand how assessing the stewardship of that data can act as a use case to help evolve the data stewardship framework and its components. So while Health Canada InfoWay is really leading the technical aspects of the patient summaries within the different jurisdictions, we have been working closely with them to sort of map out the data flows and the decision-making around how patient summary data can, or in the future will be used. We've been looking to see if the required policies are sort of in place to share patient summary data with patients, providers, and other downstream users across the jurisdictions. And ultimately, the goal of this is really to use this use case to identify any strengths and any potential gaps or areas for enhancement within the framework. It'll also help us identify areas for prioritization for the toolkit development. And then kind of on the flip side of that, stewardship will also help move the patient summary work forward. So it'll help with the overall governance and sort of the data quality of patient summary data. It'll help sort of improve the consistency and support cross-jurisdictional use. And it'll help maximize the use of patient summary data beyond just patient care, really enabling that secondary use of data for research and innovation. So as we're kind of going through this overview, you might be asking yourselves, who is the actual audience for all of this work? So when we think about the audience for data stewardship, there's a lot of different roles and a number of different players. So we've kind of grouped them into two main audience types. So first we have the jurisdictional decision makers. So this is more at the strategic level, likely a step away from working with the data on that day-to-day basis. And we really look to them to endorse the framework and support the implementation within their jurisdictions. So this would include the governments, federal governments, privacy commissioners, First Nations, Inuit and Métis organizations, Pan-Canadian health organizations as well. And then the second type of audience is those who work more with the data on that day-to-day basis. So it's those individuals or those organizations who capture, process, share, or use the health data. So we look to them to actually implement the framework and to use those toolkits that we create. So this includes health delivery organizations, health service organizations, researchers, clinicians, and the public. So over the past almost year, we've been very busy doing a wide variety of engagements. We've held over 100 sort of targeted sessions with stakeholders to date. And throughout these engagements, we've obtained a lot of really helpful feedback. So I've summarized some of that at a very high level here. So we've heard first that there is strong support for CIHI to be leading this initiative, which is great. We've also heard that there is a need for more clarification and definitions. So specifically around what data stewardship actually is and who is doing what in this space. We've heard that there's a need for both sort of consistency and flexibility. Jurisdictions need to be able to continue working on their sort of in-flight initiatives, and they need to be able to work with the structures that they already have in place, but with more, clarity and consistency. We've also heard that both the governance structure and the framework really need to be practical, simple, and inclusive. So we've been taking all of these notes, taking them back, and really making sure that as we develop our resources, that these key aspects are taken into account. So I also just wanted to quickly highlight two specific stakeholder groups, the First Nations, Inuit, and Métis organizations, as well as the public, as both are really critical groups to be engaging with. On the First Nations, Inuit, and Métis side of things, CIHI is continuing to build our relationships with our Indigenous partners. We're continuously working to ensure that the deliverables from this work reflect and respect the principles related to Indigenous data sovereignty. Some of our engagement efforts here include inviting First Nations, Inuit, and Métis representation on our external committees and other stakeholder events and activities, establishing relationships with a range of First Nations, Inuit, and Métis organizations like FNIGC, ITK, Métis National Council to ensure that there's a distinctions-based engagement across the regions, and leveraging already sort of established relationships and activities underway. So for example, through CIHI's internal Indigenous health team or through members of our advisory committee to really try and minimize the engagement burden on Indigenous organizations. And lastly, for the engagement piece, we have the public engagements. So it's really critical to the success of this work that patients, populations, and communities are really at the core of all the decisions about the disclosure, access, and use of health information. Engagement activities include involving patients and public advocacy groups in the development of the stewardship framework to gather public's perspectives on the data stewardship principles and the use of health data, engaging in meaningful dialogue with community groups representing populations who experience health inequities, and hosting information sessions that really focus on raising awareness and educating the public about the importance of data stewardship approaches. And lastly, sort of making as much information on the initiative as we can publicly available. So for example, you can find content on the Stewardship Initiative available on the CIHI.ca website. So now that you understand sort of the goals and the deliverables associated with the Data Stewardship Initiative, I just want to highlight kind of the bigger picture, sort of highlight the impacts that data stewardship will actually have on the health system. So adopting a health data stewardship approach will mean that health system data stewards will have the tools in the community that they need to really manage and share data in safe, ethical, and transparent manners. Patients and really all Canadians will benefit from health information being shared securely and efficiently across care settings and with trusted partners for the both individual and public benefit. Clinicians and healthcare providers will have the information that they need to provide care to their patients and improve quality of their care. And health system leaders, data users, and researchers will have timely and secure access to quality data to efficiently manage and improve health systems and really generate actionable insights. So as a really quick conclusion, what will it take to realize these benefits? We're thinking there's three main things. It'll take everyone really working together, that national collaboration and agreed upon governance. Number two, it'll take clear guidance, sort of in the form of a stewardship framework and stewardship principles, which provide that foundational sort of rules of engagement. And number three, it'll take practical tools and learning in order to equip everyone with the knowledge they need to put the framework into action. So those are all of my slides. Maybe I will stop sharing there.